Hi everybody, welcome to this Aspiring Medics conference for both medicine and dentistry. My name is Dr. Yusuf. I'm an Oxford graduate and also the founder of the Aspiring Medics. So in today's session, we're going to be going through all things that you need for the medicine and dentistry application process right from the start, from work experience to personal statement to interviews. And then in tomorrow's session, guided by Minshu, who scored 3,360, she'll be able to go through all things UCAS related as well. So let's get into it. What is the Aspiring Medics? So we're the UK's #1 platform for aspiring medics, run by top UK medical students and doctors. And our key focus is always on being community focused as well. And in terms of our accolades, they speak for themselves. We've worked with multiple different universities. We've had many users utilizing our platforms, utilizing our online video course, our YouTube, our AI platform as well. And a key part of what we do is also working with over 100+ schools and charities. We've been able to work with the NHS, we've been able to work with the Sutton Trust, with the Social Mobility Foundation, and access is a major part of what we do as well. Who do you have? You've got myself, Dr. Yusuf. You've also had Jacqueline, who you've also, I'm sure, come across in our WhatsApp groups and is doing an absolutely amazing job. My story, so it makes me sound so old, but I applied back in 2018 and I went to a state school. I didn't have any doctors in my family as well. And so it was very much an uphill battle. And I experienced firsthand the information gap, the inspiration gap, and skill gap as well. So this is to help you guys get in. I was very lucky enough to get into study at Oxford University. I'm now still working as a doctor at Oxford University Hospitals as well. So you're in really good hands today, not only just for getting into medicine and dentistry, but also at Oxford as someone that's actually gone through the process with this as well. So let's go through this as well. One of the awards I was really lucky to have received last year is the Diana Legacy Award as well, and that was last year where I was able to meet Prince William. So I think this is a really incredible position where we've been able to have a massive social impact, and I'm really privileged to be able to be in a position at this conference to speak to you guys and help you guys out as well. So this is going to be a rough timeline of what you can expect in terms of what we're going to be covering. So we're going to be covering all things related from the personal statement. We're going to be talking about work experience. We're going to be talking about interviews, ethics and discussion, and we can also do an Oxbridge taster as well. This session's ultimately guided by what you guys want as well. So it's going to be very much guided by audience participation, what you guys put through on the chat as well. And I'll be constantly flicking between the chat and the slides. So let's go through it. If you haven't already, please be sure to join our Year 12 Medicine and Dentistry WhatsApp group. I'm going to pause now, scan the QR code that you can see here, and that's going to be able to put you in a really strong position when it comes down to actually applying as well. So I'll give you guys a few minutes and then I'll go straight into the session. We've got a few more people joining us, which is absolutely excellent. So the core framework of the personal statement, let's go through that now. There's quite a few aspects, and obviously it's changed now, but we'll go through this together. So what we're going to be going through is the foundations of the personal statement. We're going to be going through reflexive content, how to make it university specific, how to avoid common pitfalls, and our ultimate statement strategy as well when it comes down to the personal statement. So over to you guys, actually. What makes, looking on the chat, what makes a good personal statement? What are you aware of for medicine, dentistry? How are you approaching your medicine personal statement at the moment? What are your things that you're considering? Good, Alina. So reflections on skills and life as a doctor, talking about the 6 C's, unique experiences, reflection, telling a good story. Absolutely. So some universities do use it, particularly when it comes down to icebreakers. And I think regardless of how it's used, being quite frank, the personal statement is being used less and less now when it comes down to years, because they actually acknowledge that one of the easiest things to compare people to is basically simply put what their UCAS score is, as opposed to their personal statement, which is more nebulous. However, it's very useful to know and be aware of, particularly when the fact that actually, no matter, even if it's used or not, it's very important to get into the skill of reflecting. And actually, if you can write a good personal statement, you're going to be in a really good position when it comes down to speaking about yourself in the interviews, whether it be for personal values, whether it be for work experience as well. So the thing to say is it all goes in the back. Different universities will use it differently. Increasingly, the personal statement is used less, but being aware of how to craft one is going to be really important. So There are various aspects that you want to cover. So you want to cover why medicine, why choose you, what you've accomplished, and also what you've learned as well. And there are different techniques that you can use. The ones that we recommend is a STAR technique: situation, task, action, result, reflection. And as I say, you want to focus this on either why medicine, why dentistry, for example, and you want that to become clear. So you want to talk about, and this is relevant for both medicine and dentistry, it's about your motivation, your commitment, your genuine enthusiasm. You want to show your intellectual curiosity. You want to show your actual experiences that you've been able to do this. And as I say, you want to be thinking about either massively online courses, either EPQs, lectures, and all of those are situations that you want to use as evidence to prepare you and to demonstrate this as well. And good, well done, Kira. So that's a really good link there. So that's the UCAS link as well. I'll also put on there the new medicine personal statement changes. We've created a new blog as well. Pop that on the link, and that will also be something to help you guys. So I'll pop that now on the Google Meet link now. The recording will be available to you guys in due time as well. I say we are recording this session. Okay, so what you've accomplished, you want to be covering your insight into the profession. You want to ensure that you actually acknowledge both the challenges and rewards when it comes down to career in medicine or dentistry. You want to talk about clinical exposure, and we'll talk about work experience that many students that we hear from struggle with, whether it be online or whether it be in person as well. We also have within this an online work experience course that's absolutely free, and it's something that I would 100% recommend you guys use. Please do not pay for work experience. There are loads of opportunistic companies out there that will charge for work experience in person, when actually, as long as you can demonstrate the values and the importance, it does not matter. It really doesn't matter where you get it from as well. So I've just popped that as a link on the chat. So you want to reflect on relevant experiences. You want to talk about your personal growth, so insights into empathy, responsibility, resilience, self-awareness. You also want to demonstrate how you've actually strengthened those skills. Now, a common mistake that occurs when it comes down to the personal statement is saying, I have done work at a care home and therefore I have developed my communication skills, and these exact communication skills are what I'm going to need as a doctor. People pretend as if, right, ding, they've done it as a tick list, that's all I need to do, that's all that needs to be focused on. No. You don't just get communication skills. It's a process, and it's an iterative process. So instead, what you want to be saying is, oh, I saw the importance of this in the care home or in a hospital or with the dentist, and that's an aspect that I aspire to gain and to get from, to learn from these consultants, to learn from these other doctors about. But you don't want to say, oh, I've just learned these skills from observing something once, and that's that, and now I'm all good to go for the next 6 years. No. It's an iterative, cumulative process. We're always constantly learning as doctors. I'm constantly learning, and we're going to be going through this in further detail as well. So when it comes down to reflection-driven content, you want to be specific and personal. So admissions tutors want to see genuine and well-reasoned motivations, not cliches. You want to show insights into the role of a doctor and the understanding of the profession, whether it be, as I say, for doctor or whether it be for dentistry. You want to show academic curiosity. It's going to be lots of years, 4 to 6 years of university, whether it be for medicine or dentistry. And so it's going to be really important to show your genuine curiosity amongst all of this as well. In terms of what I last said, just to highlight that again, you want to say you have further developed your skills, that you aspire to be part of the same skills, to learn the same skills that you've learned, that you've seen the importance of during work experience. What you don't want to say is, I have achieved communication skills, I have done it, and therefore this exact skill is exactly what I'm going to have to this level in 6 years' time. You want to show that you're a work in progress, that you've further developed, further honed, but never make it out as if, ding, you've just done it and that's it. We're always constantly a work in progress. If you guys have any questions, as always, please do drop it on the chat. I'm constantly going through that as well. So, for example, you want to show particular skills and tips. So these could be in terms of supporting others. It might be for dentistry, you want to restore confidence through dental care. It might be you want to promote public health. But you'd also want to be careful not to use too many overused phrases. And I think a particular bugbear for admissions tutors is to simply say, I want to help people, for example. So it can be used in a variety of different situations. So as mentioned above, these can be scored and used to shortlist for interviews. These can be used in borderline candidates who have exactly the same number of extracurriculars. They can be checked for fitness to practice. So the one thing to be important of is do not ever lie in your personal statement. Never, never lie in your personal statement. Indeed, it's not about what you've been able to do, it's about how you've been able to reflect upon it as well. And we'll talk about an example of that. It can sometimes be used in interviews as a talking point, or it can be used as a icebreaker. And that icebreaker question, for example, in Oxford or Cambridge, can sometimes be done literally as an icebreaker, but it might not be scored on as an actual domain. However, if you're stuttering and umming and erring and not able to answer a question about what you did for your Duke of Edinburgh expedition, that's going to start to ring some alarm bells. So even though it might not be officially graded, it can be used as a talking point in interviews, and it's supposed to be like an easy softball question of something you're very much aware of. So just be conscious of that as well. But sometimes it can just be flat out ignored. Some universities don't use it as much. As I say, another aspect of it is the fact that you from now are honing the skill of reflection. And I went through so many drafts of my personal statement. I went through like 10 different drafts of my personal statement. So be conscious of that. And actually that made it much, much easier for me to reflect. And what we'll talk about is something called personal statement trimming. So anything that you don't use in your personal statement, you can actually use for your interviews as well. To give an example, the head of medicine of admissions in Oxford interviewed someone, two people. There's one person that worked at Tesco's and there's one person that did neurosurgery. Which one do you think was more impressive in interviews? Do you think it's the person that did the neurosurgery, that saw the neurosurgery, or do you think it was the person that did Tesco's, and why? It was actually the person that did Tesco's, because they were able to fully reflect on this experience and actually talk about the communication skills, for example. And exactly, they were able to learn the transferable skills. Whereas the person that did neurosurgery was like, oh, I saw the brain getting cut open as well. So it's really important to be aware of this as well. And they often tell you this at the open days. And that's the story that I'm sharing as well. And I actually heard this at my open day in 2018 as well. So it's really, really important to be aware of. And it puts you in a really good position. So weighting on each course and each factor, this can vary, but this is a rough guideline to help you guys. So 10% can be focusing on why this course. The majority of it, you want to be focusing on your work experience and volunteering. And then you also want to be focusing on the scientific content and the weighting, extracurriculars and conclusion. This is a rough guideline as well. And we'll also talk about the new personal statement format as well. So it can be used in a variety of different ways, and here are some examples. So Oxford can use it for the basis of an interview discussion, I say at the start. King's, for example, can use it for shortlisting. Brunel may use it for the selection panel. I say it's used in a variety of ways. Some consider it to be used holistically as well. So it's just something to bear in mind. So the usage of this will vary, and obviously if you're applying to 4 different universities, regardless, it's important to get a good personal statement that you've reflected on that's going to be a useful skill for you as well. During interviews as well, it can be used in a variety of ways, and I can send you guys to the table in terms of how different universities utilize this, and you can see this. So when you're asking about Imperial or UCL, you can see Imperial, for example, how they utilize it as well. We're going to have a variety, we're going to have a whole university guide that you guys will be able to access as well. The purpose of this session is to really focus on the general usage. When it comes down to specific university questions, don't worry, we've got you guys covered. We'll have this in our university guide as well that you guys will be able to access. So it's important for dentistry. So when we talk about MMI, so that's come up. So MMI is multiple mini interviews as well. And yes, the university guides will be absolutely free for you guys to be able to access. So you want to show you know the job, you want to tailor it with precision, and you also want to be aware of that, and you want to show how not only are you able to talk about your experiences and reflect upon it, but not just say, oh, I did X, Y, Z, and that's what I did. So reflecting on it is going to be really, really key. Similarly, for the dentistry personal statement, it can also be utilised for shortlisting applicants, to be asked questions at interview, for example, at Dundee, Liverpool, Queen Mary. But for example, at some universities like Plymouth, it's completely ignored. For Bristol or Manchester University for dentistry, they might only read it on borderline candidates as well. And the R&R form will also be utilised. So some universities will ask for evidence when it comes down to extracurriculars or certificates. Not all medical schools, but some will. So that's something that's important to know and to go through. So that's really, really useful. And we'll go from there. So dentistry, as you can see, you've got various university types as well that you can see here and we can go through. And also, guys, please be aware to not put out external links that you find from other websites as well, because we can't verify them. So discussing work experience and volunteering. There are different examples from work experience that you can talk about. So you can show that you've explored your options and made a mature, informed decision. And I say dental applicants should distinguish from medicine. And I say, obviously, it's very different careers that you want to then talk about. In terms of medicine personal statement examples as well, you can also find on the Aspirations website the old format. And you can find on there different examples. You can also find yours truly. So you can find my own personal statement example that you'll also be able to access and go through. So I'll just send that on the chat like so. And that's something that you can then go through. All right. So you want to be able to show insights. So for example, volunteering in a care home taught me how challenging yet rewarding it is to support the elderly, deepening my commitment to a caring career. So you want to show long-term commitments, dedication and growth. So that second link, this one here, should now work for you guys if you have a look here. And you can also talk about non-clinical exposure as per the example with Tesco's. Have a look and obviously make it specific and tailored. So have a look at the specific universities that you're looking at. And as I say, different universities are going to have different styles here. Okay, so you can see here that we distinguish between Manchester, Sheffield, Bristol, for example, and for example, Cardiff. So it's important to be aware of this, cover the core values in terms of motivation, self-awareness, caring nature, etc. As I say, we have a free online work experience course that you can utilize. It's completely free. That has over 100 hours that you can utilize. You'll be able to get a certificate at the end of it as well. And I think that's something that's really good. There are other companies out there that give you an hour or 2 hours virtual work experience as a webinar and then say, oh, okay, here's a certificate from it. You really want to be getting as much exposure as possible. And that's going to put you in a really, really good position as well. So online work experience can give you an example where you can go through different types of surgery, so all the different specialties. It's amazing to hear that some of you guys have already done it, which is phenomenal. And it's really important to understand both sides, from wards to bedsides to also the lab as well. So actually check it out. It's completely free. We've got AI flashcards as well. We've got PDFs. So we've got some super good stuff from it. I say it's completely free. And I think that's a big value of what we do at the Aspirations. Is so much of what we have is completely free for you guys. So you definitely go access it. So we have new changes with the personal statement, don't we? So I'll give you guys a second just to have a read of this. So we've got a new structure here. So instead it's going to be replaced by 3 structured questions. And the purpose of this is to level the playing field and reduce any stress that can be caused from this, especially with the old, more free-form essay format. It's still the same length, still 4,000 characters in total, but with clearer guidance for each of the questions. So the 3 questions are as follows. Why do you want to study this particular course? How have your studies prepared you for this course? And what have you done outside education and why is it useful? So definitely go check it out. It'll be very useful for you guys as well. Ultimately, what you want to show is reason, preparation, and also extracurriculars as well. And that's going to put you in a really good position and a really good stead for this. So you want to show your passion and understanding of the profession. You want to demonstrate your academic readiness and key skills. You also want to show practical insights and personal qualities as well. We also have a YouTube channel, so if you haven't already, go check it out. We've got close to 10,000 subscribers now, so please do go check it out. We've got loads of free content there when it comes down to health statement, when it comes down to UCAS, and by far we've got the biggest repository of medicine interview questions as well. We're going to be expanding out further to what you guys want. So if you guys want more dentistry interview questions, if you comment that down on videos, that's something we can also do. It's completely free. We've got highly edited 4K videos for you guys to access, so enjoy. As I say, we've got the online work experience course that's free. We've got our YouTube channel that's completely free. We've got a whole website guide as well to help you guys. So if we now zoom into each question, for example, why do you want to study this course or subject? You can talk about the motivation and human drive. So you can begin with a specific experience or your long-standing curiosity. You can blend science with compassion and showcase interest in both your scientific complexity and also the human side as well. So all of that you can utilize to your advantage. You can talk about your insights and reflection, and also early career exploration as well. So in terms of how much extracurriculars you do, that's going to be very much dependent on basically the space you've got for your personal statement. I would always encourage you to sign up to as much as you can do, particularly in terms of going through each and every single one of the qualities of a doctor. So if you have a look at the Medical Schools Council values in terms of qualities of a doctor, that's going to be really useful for you. And you can literally see it as a table. And therefore you can think about, okay, how am I maximizing this as much as possible? Okay, so I can share this with you guys here. So this is from the Medical Schools Council. There are 2 links here, like so, that you guys can check out. So that becomes really, really important to have a look at and to go through. So you can do it in EPQ, you can do Duke of Edinburgh, you can do all these things, so we can go through this as nitty-gritty. However, the key thing is, are you able to reflect on it? And does this demonstrate each of the qualities of a doctor? Does this make you a well-rounded applicant for either medicine or dentistry? All right. So absolutely, it's reflection that matters the most, not what you've done. It doesn't matter how many days you've done. It's not a case of, oh, should I do 10 days of a care home or 2 weeks at a hospital? It doesn't matter. It's about how you've been able to learn from this. I say this whole recording is going to be recorded and it's going to be uploaded online as well. So rest assured that's going to happen in due time. So in terms of our online work experience course that we've got, we're going to be able to go through it. It's mainly focused on medicine, but you can also utilize it for dentistry as well. And I say there's lots of overlap. So you can very much still use our medicine online work experience course for dentistry, particularly when it comes down to knowing how to reflect as well. All right, so let's go through more of the content. When it comes down to the second question on the personal statement of how have your qualifications and studies helped you to prepare, these are the 4 pillars that you can think about here. So again, you can think about the STAR technique: situation, task, action, result, reflection. And you can take different examples. So can anyone put on the chat something that they're struggling with as a reflection, and we can go through that. Does anyone have any examples of anything that they're currently struggling with in terms of knowing how to reflect? So even, for example, say working at Greg's, for example, you can then talk about the interaction that you've been able to have with a range of different people, knowing how to work in different situations, whether it be as a cashier, whether it be actually helping to make the actual pastries, for example, following instructions, going through a protocol, making sure that you're doing it in a sterile technique. So you've got food preparation aspects that you can compare to surgery, for example. The other aspects within that you can also talk about is actually when things go wrong. And there are so many examples when things go wrong. I worked at Boots Pharmacy, for example, and I also worked at a hospital. I worked at care homes, so I did different ones, and then also at Specsavers and opticians. There was one example that I spoke about in my interviews, and again, it's really important to show these errors and highlight actually the fact that as doctors, no matter what, you will make mistakes, and that will happen. And it's important to be aware of this as well. So one of the examples was the fact that actually I had these new pair of frames for a customer and I was cleaning them up. What I didn't know was that these are cold frame glasses that you're not supposed to spray. So we used like this spray that basically just makes it really cold, and then you can like wipe the lenses and clean it. So The customer I saw last week, and they got them, they chose them, great, fantastic. And then she went to put them on, and she was like, yeah, great, okay, I'm just gonna get rid of the yellow markings, the little adjustments there. So I go to the corner, I put the cold spray on the non-cold spray glasses, and they broke literally right in front of my frames. And I literally just showed them to her just now, and she's like, she was so happy with them. And guess what I had to do? I had to then go to her and be like, I'm really sorry, I broke your glasses, I used this cold spray on these non-cold spray frames. And I explained the situation, and I was like, oh my God, here we go. And then she was actually completely understanding. She's like, oh, okay, thank you for being so honest. And it was lucky that actually there were another pair of the exact frames. So luckily we just had to pop them out into the new frame and no harm done. You will make mistakes, and there will be errors that occur either from colleagues or whether it be from yourself as well. We're all humans. And a really, really key important aspect of both medicine and dentistry is actually owning up to your mistakes. And that's really, really important. And that's one of the examples that I chose. And I think it can be easy to think you have to be the perfect candidate in every way, but no, you don't. And I think that's something to be important and aware of as well. Okay, so transforming experiences to words. So guys, also just to say, it's worth just keeping cameras off just for the purpose of this. I say, please do keep your questions through on the chat. I'll be able to go through them as well. Obviously, we've got a set curriculum as well within the slide, so it's basically managing both that and your questions. So we're going to have loads of times to go through that as well. So here's a lovely one. How to reflect on volunteering to feed patients at the hospital. You tell me, open to you guys now. How do you think volunteering to feed patients at the hospital can be used as a reflective example? So if you guys pop it on the chat, I'm going to give you guys a minute or two to have a think. And I think that's actually a really good one that can actually help to distinguish the good applicants from the fantastic applicants. And you guys, I want you guys all to be fantastic applicants, okay? I want you guys to be in that top 5%. Or someone raised their hand, or if whoever raised their hands, you're welcome to unmute. Or you guys can pop it on the chat, whatever's easier. So we've got, it teaches you patience, being exposed to different types of people and seeing how doctors deal with these difficulties and adapt to them. Good. Communication. Good. So let's go through this, because I think there are some root causes here, and I think there's good, but I think we also want to make it specific reflections to this circumstance where you're volunteering to feed patients at a hospital, for example. You can first start off with, from an Oxbridge side, why are you in, why do they need that help? And for example, is it because they have a stroke? Is it because they've got Parkinson's? Is it because they've got a neurological problem? I.e., do they have a nerve problem that stops them from being able to fully access what they want to? So that's something that's really important to be aware of. And if it is because of that, that's something that can then be adjusted as well. So being aware of that is going to be really, really important. So that's the first thing you can talk about. You can be like, during my hospital experience, I saw a stroke patient who wasn't able to swallow, because a stroke is basically an occlusion, i.e. a blockage in one of the arteries of the brain. And it's a reduced blood supply that then affects the brain tissue. When it affects the brain tissue, it therefore affects the nerves functioning of that, for example. What you can then also talk about is then, okay, on a personal level, you understood that, you were able to potentially speak to the doctors about it or whatever, so you could understand about a stroke, and that could get you off to then talking about leapfrogging about talking about strokes and Parkinson's or whatever. The other thing you can talk about is the multidisciplinary team. You can then talk about the speech and language therapists, SALT, S-A-L-T, and they're really important when it comes down to situations like a stroke. I think a stroke is something that I like to talk about and encourage students to talk about in a personal statement, because it highlights the importance of a multidisciplinary team, because a stroke is a multi-system aspect that affects all aspects really. So even though it could be considered a neurological stroke condition, actually there's so much that you can talk about within that. Okay, you can then talk about, actually, you know what, because the stroke affects all of this, they're not able to swallow, so who are you going to get involved? The speech and language therapists. They're not able to move their legs, who are you going to get to speak to? Oh, you can get the physiotherapists to get involved. Oh, someone, because of a stroke, because of the fact that they have an unsafe swallow, guess what happens, unfortunately? They can aspirate, i.e. they can choke on some of their food so it can go into their lungs. Unfortunately, if someone has a stroke that affects their swallowing, it can then mean that they're not able to move their lungs about, and they get chest infections very easily, unfortunately. And that can also be a big part of why they can deteriorate. So you can see that how feeding, you might be like, oh my God, I'm just feeding someone. Oh, this is not useful. No. You need to go deeper than that. And this is going to be useful not only for Oxford, but otherwise. Why do they need to be fed? What neurological problem do they have? What scans did they have? So then that's what you're about that. You can then talk about the multidisciplinary team, that speech and language therapists take a really important role, for example. And that's going to be in terms of, as I say, in terms of potentially thickeners, deciding who's got a safe swallow or not. And I think it also makes you, and you can say this is a personal thing, they can actually need help with this as well. So MDT are the multidisciplinary team. So quick question on the chat. Who is involved in an MDT? As many roles as possible. Who's going to get the most amount of roles? So multidisciplinary team, go. I want loads of different roles. Good. Physio, speech and language therapists, very good. Physician associates. So you've got doctors in them, and then doctors, we can consider all the different specialties. Be aware, a radiologist is a type of doctor. So someone said doctors, and radiologists. Radiologists are doctors. So GPs, all of those are types of doctors. I'm not going to consider that here. Radiologists, pathologists, they're all types of doctors. They're all specialties of doctors. So are GPs. Who else? So radiologists are the people that interpret the scans. What's the technical name for the photographer of X-rays? Who actually takes the photos? What's that called? Someone's put it on there, but what's it called? Good, that's a radiographer. Good, like a photographer. Precisely, that's exactly right. Good, so you've got HCAs, you've also got pharmacists, physiotherapists we've mentioned, discharge coordinators as well, porters, pharmacists, pathology assistants, receptionists, ward clerks, drama therapists. Very good. Yeah, absolutely. Chefs. Yeah, you could. Less so, it's a multidisciplinary team, but nonetheless important. And yes, clinical nursing. There's so many specialty nurses. There are sepsis nurses, infection nurses, diabetes nurses. So for reference, nurses are amazing at what they do, and that becomes really, really important to be aware of. And I think nurses just think, and nurses can play loads of different roles. You've got some nurses that are able to prescribe. They are nurse practitioners. There are some nurses that are really, really highly specialised. For example, Oxford University hospitals, we've got vascular nurses, diabetes nurses, and stroke nurses. The stroke nurses can order scans and they can give stroke medicines. If I've got a patient with high blood sugar levels, as well as insulin that I can prescribe, if it's persistently high, I actually refer them to the diabetes nurses as well. So that's something to also be aware of and to go through. So any questions about that so far on anything that we've mentioned? Oh, Oxford University Hospital is really fancy and really different to other hospitals. They're not that different. They're very much the same. I think it's more the fact that whenever you've got a teaching hospital, that does mean the flavour slightly differently. So obviously lots of the doctors there are obviously, like, lots of them are alumni from Oxford University, and also do a lot of teaching and research as well, which then means the flavour of that, you get more of that flavour as well. Good. So you can talk about how, as you can see on this sentence starter, it deepened your understanding of, it deepened my appreciation from this. And from this, I realized, and again, that MDT is going to be really, really important. A question on the chat: won't MDT in general be different than MDT for a surgery? Absolutely, very good. So MDT for a surgery might be more focusing on scrub nurses, for example, and that is going to then have like an anaesthetist, a surgery, etc., etc. We talk all about the MDT in our medicine online work experience course as well, so be sure to check it out. We go through a lot of this, so if you enjoyed that as a reflection in terms of stroke, we've got so many others for you guys as well to help you, and you'll be in a really good position. It's an absolute gem, so be sure to check it out. You can then talk about building on this experience beyond the clinical environment. A contrasting challenge I faced was, in addition to this, similarly, when volunteering at, and these insights were echoed during, I say you can have a look at all of the personal statements, and you can even see yours truly as well, that you can also check out. So be sure to have a look as well, and I also talk about it. So you can find my own personal statement that I utilised to get me into Oxford University for you. So analytical reasoning or phrases. So again, you can say that it made me begin to consider. I think this is really good. So as I say, what they also want to see is humility, and actually that you actually do have a good understanding. So it can be easy to think, oh, medical school admission choosers want to see the perfect polished thing, but actually what you want to show is a deepened understanding. So rather than being like, I fed people who had a stroke and therefore that meant that I learned about communication skills as a doctor, you've just done like a Hulk leap jump for like 10 miles. What you want to do is have these little pebbles where it's very clearly linked. All right, and that's going to be also able to really help and guide you. So in terms of the other personal statements that I've put on that are available on the Aspiring Medics website, we go through this, I say, on our online work experience course that covers personal statement as well, is you want to use it as an opportunity to go through and understand the different styles and how people have linked things together. Okay, you want to make it specific to yourself. That's the ultimate thing. You want to make it specific to your experiences, and as long as it's genuine, authentic, and specific to your experiences, it won't be a cliche. But just avoid using phrases like, I want to help people. Okay, what you want to be going through is the reasons why. So with that, it can be the emotional satisfaction, it can be the intellectual curiosity, it can be the diversity in terms of patients, in terms of conditions, for example, that you can then talk about. And there's a massive aspect of camaraderie, as I say, and you can use all of that to help guide you. So here we go. So here are some cliches, as if you guys knew what was coming up. If you say cliches like, I want to help people, I've always wanted to be a doctor since I popped out the womb, that's not that interesting. And that's just not showing a realistic understanding. I think it is worth being quite frank about the NHS and about medicine at the moment. The NHS is in a big trouble at the moment, and the NHS is in crisis. And if you guys haven't already, we've actually created a video on, we want people to get into medicine and dentistry, but we also want people to make a good understanding of medicine. So we've actually got a video on why are doctors leaving the NHS, and that has got over 200,000 views on YouTube. So if you haven't already, be sure to check it out as well, and I'll pop that on the link as such. So it's important to be aware of all these conditions and qualities as well. I say they want to see that you're going to stick it out. They're making a big investment in you. Okay, on average it costs, from both yourself and in terms of the medical school as a whole and the government, it costs £250,000 to train you for 6 years. So it's a big investment. Okay, so they want to see, okay, is this person really going to stick to it? Are they going to go through medical school? Are they going to be an incredible doctor? That is what they're going to be having a look at, and I think that's what you guys also want to remember amongst all of this. So again, just saying being a doctor is my dream is very cliche. That won't get you very far. And saying medicine is the perfect mix of science and personal and people. You can instead talk about the emotional satisfaction, the intellectual curiosity, the diversity in terms of patients, conditions, and personalities. I love that. So every patient I see is very different. I've been working, so I graduated last year as a doctor, and it's been phenomenal, you know, seeing people on acute general medicine. I was working on Christmas Day I was working on New Year's Day, but you're seeing a massive variety of different patients and people, and I think that's something that you can really appreciate, and I love, and it's generally really rewarding as well. Any questions so far on the chat? Do let me know. So, building your opening paragraph, you want to capture their readers, so you want to encapsulate them, you want to get their attention, so you can talk about a reflective phrase and you can show, not tell. As I say, there is no right or wrong way necessarily. All I can do is share what I've done, what I did in mine. I say, I'm not saying that this is the perfect one, this is my experience as well. So I've just popped that on like so. What is Sutton Trust? Do they offer medicine work experience, and how do you apply? The Sutton Trust are an amazing, they're one of the UK's largest social mobility charities that we're partnered up with. They do absolutely incredible work. And as I say, you've got our medicine online work experience course on the chat that you guys can access and go through as well. I say I've put the paragraph of mine as well on there. So what's the greatest challenge you face as a doctor? Lots. We'll go through that. That's a really good question. We'll talk a lot about that in terms of when we go further in terms of then interviews and that sort of preparation. I think that's a really good one. That's a phenomenal question. What specialty are you thinking of? You're giving off major pediatric vibes. This is actually the opposite. So I went into medicine thinking I started this year wanting to go into emergency medicine. And I thought, you know what, that's the thing I'm going to absolutely love, for example. I thought the variety, but actually, after doing 6 months of acute general medicine on take, which is really busy, it's probably the busiest I've ever been in. It's like a trial by far. You learn the most though. I love geriatrics and acute medicine, and I've done different experiences in taster weeks in London as well as at Oxford. I think it's actually acute medicine. So it's really funny that actually the biggest, when you say major pediatric vibes, it's actually for me the opposite. It's actually geriatrics that I want to go into, and I think there's a real sense of pragmatism. There's a real sense of also just peace that one can have, and I actually really enjoy it. And I think you can make a really massive difference as well. Good. All right, guys. So that's really good. So, what is waffle? So you guys will know this. It's not telling you a lot about what's going on. It's about not reflecting. I think reflecting, you hear about that a lot of, oh, you should reflect. And I think it can be difficult for you guys to know how to reflect. But ultimately, you want to think, what am I telling here that's really punchy? And the test I always go to when I go through all these medicine personal statement reviews and dentistry personal statement reviews is, are you giving something profound or not? Are you telling me something that the average person, that if I get them off the streets, will they be able to tell me or not? If you're just going to say, oh my God, I fed a stroke patient on hospital and that taught me that people need to eat. What? Oh, it taught me that staff are important in nutritional intake. Meh. What you want to instead talk about is actually give better examples, and you want to talk about the complexities of a neurological problem. And for example, a stroke, is that going to be there permanently? Is it going to get worse, or does it sometimes get better? Does it sometimes not? Are they still getting fed through the mouth? Do they have a known risk of aspiration? Do they have a known risk that they're going to get a chest infection? And I've seen this many times so far working as a doctor, but actually they decide that for that person who might have an unsafe swallow, we don't think about it. And I think this is one other thing about medicine, is it makes you take things for granted. And I think it makes you appreciate things a lot more, is when you see, for example, someone that's got an unsafe swallow, but because of how human it is, being able to eat, being able to actually have those dinner time conversations, for example, then actually they decide, you know what, I still want to eat, even with a risk that I might get a chest infection, they might go down the wrong way. Can you see how that is a much more profound example than just saying nutritional intake is important? Does that make sense? Are you guys with me so far? If you just pop it on the chat, yes or no, it's just useful to know and to go through. Good. I say if there's anything that doesn't make sense, an inbox of comments, this is great. Maimuna, you've got a question. Do you want to unmute, or do you want to put it on the messages? No? Okay. If you've got a question, just pop it on the message. Okay, by accident. Okay, you're probably trying to go for a like and then you do that. The way. No worries. So let's go through this. If you do have any questions, just pop it on the chat. I think the chat's going to be better. So university specific, obviously look at them. We've got our university guide as well on our website. I'll put the link to it as well. And that's something that you can help with. We're going to also utilize AI for that. We've also got loads and loads of different examples. There we go. So if you have a look here, this is actually on our there we go. So basically you've got all of those different teaching styles as well that you can check out, and you've got all that information to help guide you as well, so you can utilize that. All right, so enjoy. So no, you only do one personal statement. So how do you, okay, this is a good question now, you're getting loads of, this is good. So how do you make it university specific if you're applying to 4 universities? Well, this is also relevant for graduate entry medicine as well, for sure, Amara. Is that you want to know, obviously you're not actually going to be like, I want to go for Cambridge, and you're just getting rid of like all the Cambridge ones. But what you can do is, for example, is with your work experience, just think, what is the vibe of those universities that I'm going for? For example, if you're focusing, say, on more Manchester, Liverpool, that's going to be more clinical, say, than Imperial, Oxford, then that's something to be important of. So that then means that in terms of the amount of extracurricular stuff you're going to be doing, in terms of research, in terms of, you don't have to do this, but it's one of the examples you can show extra reading. Not the only one, but one of. For example, if it's extra reading, that's going to be able to be really, really useful as well. In terms of all these links, there's actually it's all on our online work experience course as well. That's the main one just to go through, and that's going to give you everything that you need. If you're in our WhatsApp group chat as well, that will give you everything you need as well. I'll pop the link to the WhatsApp group chat again now on the chat, and that will be something that can then help guide you. So as I say, if you've joined the WhatsApp group, that's all you need. You'll get everything as it comes, as you need it as well. Good. So have a think. So here's what someone's put. I did hospital work experience, and also I love science. I've also volunteered and it was fun. I think this proves I want to do medicine. How would you guys improve that paragraph, that few sentences? I'll give you some time to have a look. And yes, you can join the WhatsApp group if you're currently year 12. We'll have a year 11 group chat later on. So if you're a year 11, you can join that WhatsApp group as well. So I'm going to give you guys 2 minutes. I can see you guys are joining on our WhatsApp group, which is phenomenal. So keep that up, keep that up. So please pop on the chat how you would improve this paragraph, or if you've got any questions so far. I'm going to take a quick 1 minute break, make yourselves a cuppa. If not, be typing and we'll go through it. They should reflect more on what they've learned from their work experience, why, what they love science, what they did while volunteering. I think they should be more certain and remove, I think it proves, etc., etc. Exactly, and really, there needs to be much more reflections and nuance to it. Whereas actually, this is still something that the layman can say. I agree. It sounds very babyish. Good, Aisha. That's really, really good. So you've given a really good paragraph there. That's much, much better, and much more guided as well. Very, very good. So I'd say a lot of this in terms of insight, in terms of the personal statement, is going to be very important when it comes down to graduate entry medicine. For graduate entry medicine, you want to talk about why your degree that you've done, for example, the classic one is biomedical science, has helped you, and how that has equipped you and what you've learned through those 4 years or 3 years that you've done your undergraduate medicine degree, and why you now still want to do graduate entry medicine, or potentially how it's changed, or how you side of things, but actually you think you really enjoy the clinical side. That's the examples that you want to be speaking about in further detail as well. Good. All right, guys. So the star example, how have your qualifications and studies helped you to prepare for this subject or course? Situation, task, action. So you guys can read much quicker than I can speak, so I'm just going to pause. I'll give you guys a second. So I've also put a poll on the personal statement. I'm really interested to see how you guys have done it so far, and if you guys have started writing your personal statements yet as well. That would be really useful to go through. For result and reflection, you've got this example here, so I'll pause. Again, I think you guys can read much quicker than I can speak. Okay, interesting. So overwhelming majority, it's probably about a third that has started, or a quarter that have actually started to draft their personal statement, and the rest hasn't. So when you go through it, so you should be on the either on the chat function or the 9 dots that you should be able to see polls, for example, to then join the poll and vote. Good, and we will go from there. So you want to articulate your well-informed motivation. You want to show understanding of the profession, its demands. You want to highlight your academic preparation. I say whether it be A levels, whether it be EPQ essays. You also, if you're a graduate medic or dentist, you then also want to also talk about how your undergraduate degree has then prepared you. You want to talk about your outside experiences to demonstrate key qualities. You want to tailor each answer to the question and what else. So same examples and discussion. Same, to go through it again, situation, task, action, result, reflection. This is something that becomes very, very important to do. So absolutely, Fido. So also for gap year students, it becomes very important to show what did you do in your gap year, and also showing, I think being a gap year student is a lot of resilience as well. And that would be something that's really important to show and to utilise. For Oxford Medicine, I think it's something like 30% of students are actually gap year. So actually it's very common, especially for Oxford or Cambridge, to be a gap year student as well. And you can definitely talk about that in interviews, and I think it really does show resilience. And the other thing just to say for gap year students is medicine is so damn long. I mean, it's so long. It's 5 to 6 years of studying. And that's just the studying. And then you've got anywhere between a 6 to 10 year training pathway on top of that. So actually, you're not really going to be a consultant until you're 35, 40 even. So you've got miles and miles of time. So don't worry about that. So you can talk about a variety of different examples. You can talk about volunteering. I think volunteering at care home is a really good option. Attending a lecture on cancer therapies. There are lots of lectures, YouTube videos out there, Guardian articles so you can use to leapfrog from one another. Shadowing a GP can be quite hard these days, actually. Reading an article on PubMed or from the New England Journal of Medicine, that can also be really useful as well. Yeah, so there are different reflective techniques. I think the STAR technique is the one that can be really useful. Ultimately, it is a guide and it's a framework, and what's more important is you talk about the nuance. The most important thing is the insights that you can give, for example. So, as I say, you've got different examples you can talk about, whether it be volunteering care home, attending a lecture, shadowing a GP, or intellectual challenge that you can also talk about, as I say, from PubMed articles. So, different reasons for going into medicine, science and care. So that's particularly, I say, in terms of the academic, intellectual curiosity, the communication skills, the lifelong learning that you can talk about as well. I'm constantly learning all the time. I've done 6 years of medicine. I'm still learning as a doctor, and you will always be learning as there are new treatments, new protocols, and you learn better, and that puts you in a really, really good position. So you want to show reflection after each experience. You want to clearly convey how these experiences confirm that your motivation, and you also want to balance this scientific curiosity with the emotional intelligence and service. So you want to be well structured, you want to be professional trained throughout, and you want to have key conclusions as well. As I say, if you guys haven't already, do join our Year 12 group chat. It will be happy helping you throughout that whole process, all the way from Year 12 all the way to Year 13 as well. How would you suggest starting your personal statement, especially since choosing which experiences to mention? So as I say, I can tell you that the best thing you can do is just find out for yourself. I'd say I'll put the link again to my personal statement as well to help guide you. Was it this one you wanted, Siddhartha? Was it the previous slide? This one? This one or this one? Good. All right, cool. You're welcome. Good. And in terms of care homes, in terms of actually approaching that as well, basically, I would literally just be a hitman or hitwoman, where draw a radius around where you're willing to travel. And I would recommend traveling quite far if you can as well. So please do go check it out. That will be very, very useful for you guys as well to go through. So, personal statement example, you can talk about how you love science and helping people. You can talk about medicine as a respected job. You can talk about work experience. You can talk about insights. You can talk about helping people, mentioning work experience, a respectful job. You can talk about the insights as well. And all of that will be something that can help you quite a lot. So, mistakes that people often made, as I say, is that they don't reflect, so they don't explain, and there's just not enough detail as well. There's no unique examples. They're using generic phrases, they're repetitive in general, and they lack intellectual detail and no academic exploration as well. So, how to show, not tell. Here are some examples that you can have a look at. So you don't want to say, I am empathetic, I am hardworking, I am a great team player. You don't, because anyone can just say that, but what becomes really important is then actually discussing it and talking through it as well. As I say, all of this in terms of recording and in terms of the PowerPoint, that will all be uploaded onto our online courses as well and onto YouTube, so you guys will be able to access that. As I say, it'll take a few weeks for it to be then uploaded and to be put on there, so obviously you guys experiencing it live in the flesh is going to be the best experience for you. So you want to use storytelling, you want to use mini stories that highlight a skill, you want to reflect, what did you learn? Why does it matter for a medical dentist? You want to relate it and make sure that the reader sees your qualities. So it's almost like a buzzword bingo, but in the sense that you want to be talking about all those different qualities, but you don't want to be so obvious as to say, I am a good communicator, I am hardworking, I am a great team player. What you want to be doing is showing, and you do that through your experiences. Does that make sense? So if you go back to, it could be any example. So absolutely, Amina. So if you talk about being a mentor, a leader, any experience you've had of that. But again, it's not about what you've done, it's about how you've reflected on that. How have you nurtured a team, for example? How have you been a coach? What have you done differently? And that becomes really, really important. And you can then link that as well. So you can mention stories of a family member who's had a really positive experience. Absolutely. So all of those are really, really good examples that you can then choose and go through. So activity 1. Here's a telling sentence. I am a great team player. What can you do instead of that? How can you rewrite that? So I'll give you guys a minute or two. How would you, instead of saying I'm a great team player, and relate this to your own experiences now, because everyone needs to show teamwork in their personal statement or in their interviews. So if you try and have a think, what could you do about this to improve it? I'll give you guys a minute or two. Just pop it on the chat. We're getting some really, really good feedback here and really good examples, particularly in terms of sports. Zane, this is an absolutely phenomenal example. Very, very well done. You're talking about individual strengths within the team, responding quickly to challenging circumstances. All of that is really, really good. So very good. So all of those are really good examples, and you can clearly see the links between that and, for example, medicine and as a doctor as well, and working with an MDT as well. So all that, saying really, really well done. That's a superb example to talk about. So now's your chance, guys, right? So now's your chance. You can get a free health statement review based on what you put, and we'll go through it. So I'll be selecting the best ones to highlight and showcase as well. Let's carry on. Activity 2, choose one quality, empathy, leadership, curiosity. Write how to show this. So again, if we skip through this now, one of the things that you can actually talk about in terms of empathy, leadership, or curiosity is actually showing 1 to 2 sentences in which you demonstrate that. So as I say, I think the feeding example is actually a really good one, because you can then talk about and speak to the relatives and actually getting to understand the relatives and how this condition is affecting the patient. That shows real good curiosity and empathy, and also working with the speech and language therapists, whatever, seeing how the interplay between the physiotherapists and SALT, for example. So I think that's something that was really, really good as well. So yeah, that's definitely something that you can go check out as well. Zari, wow, I swear you were predicted average grades. Yeah, I was predicted B's, C's and D's in my target grades for GCSE. I was predicted a D in maths, yeah. And I got A stars, and I got an A in a freestanding maths qualification as well, and I went to a state school. So the reason is, like, the GCSE thing, it's like, yes, I got that, but I I think sometimes it can seem a bit too intimidating, and also it's a case of if you really want to apply to Oxford or Cambridge, go for it. That would be my advice as well. But yes, so somewhere like Oxford puts higher weighting on GCSEs as opposed to, say, for example, Cambridge, and it's important to be aware of that as well. Good. So yeah, so obviously GCSEs are important for medical school as well, and alhamdulillah, I was very lucky. So yeah, thank you very much. All right, so when to start writing? Can your writing processes lack a pro? So go through all of this. I would actually say this is like a general guide. I would actually recommend starting much earlier, and you can start today. Okay, start today, even from reflecting on this webinar, and that's something that you can even put on LinkedIn, and that can be really, really useful to showcase your examples and how you've been able to do that, and that'll put you in a really good position. I wrote my first personal statement draft in April of year 13. I gave my first personal statement draft to my teacher in April. And I know that sounds really, really early, and it can be useful to do, but I think the thing that worked really well is the qualities and getting used to reflecting. Basically, UCAS preparation, you can start now and it will really kick in from June to August. This summer is very busy. This summer is very, very busy indeed. So it's just important to be aware of that. So I mean, yeah, year 12 April time. So now as a year 12, I did my first draft. Yeah, exactly. So I did my first draft as a year 12 April time. So that's something that I would recommend doing and can be particularly useful as well. UCAS versus personal statement, I mean, it's not mutually exclusive. They go in parallel. Your UCAS, as I say, you'll be really kicking in from June all the way up to August, and I say it's a similar timeline for that. Personal statement, you're going to be wanting to get that finished in those 3 months, but what you want to be focusing on now is your work experience, and you guys are doing an incredible step in actually being here. You're doing an incredible step in terms of that. I think it's important to be aware of that and acknowledge that and say you guys are doing a phenomenal job already. You're showing your proactivity as well. Loads of questions, which is good. Gap years obviously are not essential. You don't need to. You can do it first time. I got in first time, so that would be something that would be actually useful. Would they actually help with personal statement in terms of checking and feedback? I'm not sure which summer school you're referring to. It depends. Different summer schools help in different ways. I'm not sure if you're talking about a university affiliated one or like a company one. So there's so much stuff we need to do. It's a bit scary. I'll be honest. Yes. I'll be honest, there are lots. There's lots to go through, and I think that's one of the reasons that I'm really passionate about these conferences. Oh, the slides are so interactive and so cool. Damn. Oh, thanks. I really appreciate that. So it is. You've got a lot. That's why we're running this. And this summer, I'll be honest, guys. This summer, the next 12 months, 16 months are really, really busy. And this is something to really be aware of, and that's why you guys need guidance, and that's why I want you guys to be able to make the most out of it. And I say join our website, join our WhatsApp group, for example, and that will put you in a really good position. All right, we'll go through how to reflect on this, and we'll go through different examples of what you can talk about. Let's say what would be amazing is you guys actually being able to reflect on this and then mentioning the Aspirations on LinkedIn, because one, if you guys don't already have a LinkedIn, what are you doing? Get LinkedIn. There's loads of really, really good stuff on LinkedIn out there for opportunities to connect with the other aspiring medics, to connect with other medical students, doctors. It will be fantastic. And I promise you, I'm not sponsored by LinkedIn in any ways, but LinkedIn is an incredible resource to utilize, for example. So LinkedIn is basically like Facebook, but for work. And it's a place where you can connect with other professionals, where you can post about stuff, and we will talk about how you can utilize LinkedIn. But just have that in the background and think about, as you're going through this conference, think, okay, what can I reflect upon? What can I talk about? We'll be able to go through all of this as well. Good. Some people found this webinar through LinkedIn. Very, very good. So we will go through how to use LinkedIn and everything. I say I'm not sponsored by LinkedIn. I think it's just an incredible resource. I use it every day, and it's absolutely incredible. So think about redrafting things, and actually you want to be able to get everything ready. I actually disagree with this. I'd say actually you want to be in this position. You want to get it nice and early, and I want your personal statement to be done in September as well. Your predicted grades, dependent on your school, usually get sent across in September. It depends whenever your school sends it off, usually in September time in year 13. So feedback loops, emphasis. So structure, content, reflection, tone, grammar, and polish. This becomes really, really important. So you want to make sure that your personal statement is to the point. Have you clearly answered those questions? Have you reflected on experience? Have you elaborated rather than just help people? Have you done your further reading? Have you also demonstrated other key qualities as well? Absolutely. So Ria, this is a really good question. How did you balance your extracurriculars, revising for marks, revising for UCAT without getting burned out? I'll be honest, this is a very, very busy time for you guys. And again, I do want to underscore this, and I will say that actually this is a very busy time for you guys. I think I've done 6 years of medicine. Okay, I've done 6 years of medicine. I'm now working as a doctor. Okay, I think year 12 is the biggest, and year 12, year 13 is the biggest bottleneck. I think I was probably the most stressed in year 12 and year 13. Let that sink in. I think the most stressful time is year 12, year 13. I've done 6 years of Oxford University, okay? And you get such incredible support that even though you've got lots of work to do, you're really, really well supported. I've worked as a doctor. I've been working as a doctor with people flatlining, with patients on the brink of death. I found year 12, year 13 more stressful. So I just want that to sink in, and I want you guys to appreciate that this is the time, because what you guys need to now do is lock in, get into medical school. When you get into medical dental school, there is then so many ideas and so much support there for you in terms of tutors as well. So I think you guys want to be aware of this as well. So yeah, exactly. I did so much in terms of the Aspire Medics. I ran this whole thing, this YouTube channel and everything, whilst at university. There is a big step up, but you have got so many weapons at your disposal. You've got so many tools, you've got so many allies, you've got so many tutors there already. And so I think that's something just to be aware of. So that's something just to be aware of, and let that sink in. Okay, so it is a bit intimidating, but I'd rather be really honest with you guys and be like, look, the next 12 months from now to year 13 to the end of year 13 is busy, and this is go time. Okay, this is the time where you guys make it work, and this is the next 16 months where you guys need to be on it, joining our WhatsApp group, joining our YouTube channel, having a look through all the content and really being proactive. And this is where you can make a phenomenal difference. And getting into medical school, dental school can genuinely be life-changing, and it can be genuinely phenomenal. So this is what we're going to be able to go through to help you guys. Any questions so far on that? I know it's a big statement, but I think it's important to be really open to you guys as well for this as well. We have an Aspiring Medic program where disadvantaged students can get free access to our online courses, including to our online video courses and to our AI platform as well. And I'll put that in the link. We'll go through what medical school life is towards the end, but I'll sort of stick to chronological order. But any questions so far in terms of the personal statements so far, or in terms of balancing aspects? Yeah, so reacting to when got into medical, Oxford was absolutely magical, and going to interviews there when it was like snowing is just like incredible, like absolutely incredible. I've done like day in the lives of an Oxford medical student. You can find that on YouTube. Like, I've loved it. Like, it's really been amazing. It's like Hogwarts, and it's incredible. It's truly amazing. How much did I write for each question? Have a look on my personal statement. I say this is my one with the new form, with the old format. You guys have the new format as well. If you're in year 13, do you recommend doing this after A-levels? As in, should I take a gap year, yes or no? That's a personal decision to make. I would recommend Medify, and with our group courses that we'll be doing for UCAS, you'll also get free access to our to Medify courses for free as well. The new format's easier in terms of it's more clear-cut as well, whereas the other one's kind of like thinking, predicting what you think you know, and it makes it a bit harder. So good, we'll go through all this stuff in terms of universities versus 6 years versus 5 years as well, and that will be really useful to go through. So what further reading can gap year students do? Well, it's the same ones that actually any student can do, and that can be particularly in terms of New England Journal of Medicine, PubMed, The Guardian, YouTube. Check out our YouTube channel. We'll also create we can have a book club, etc., that you guys can also learn from and utilize. All right, so the other aspects to think about, say, is the STAR technique, the tone. Are you being concise enough? Have you proofread it? And are you demonstrating all the qualities of a doctor? This becomes really important. So Oxbridge versus non-Oxbridge example requirements. So obviously Oxbridge is going to focus heavily on academic interests. Cambridge will not score the personal statement. Oxford can use it as for interview, and non-Oxbridge may apply more weight. Keele scores a roles and responsibilities form, and Birmingham expects clear motivation. So these are some examples, and as I say, you'll check it out in full on our university guide as well. Any questions so far before we crack on? Good. Okay, so if you're looking at the Oxbridge statement, you want to be focusing, I say, on focus, style. So you want to be a bit more formal. You want to be focusing really on the research aspects of things as well. Yeah, medical and dental school news as well. I say it's about how you're able to learn from it and think about it. I think health inequity is a big thing at the moment, and there's so much going on as well that you can have a look at. So for non-Oxbridge statement, I say you want to focus on your focus, style, goal. For Oxbridge medicine personal statement, we've got a whole Oxbridge personal statement review. We've got Oxbridge interview tutoring. We've got all of this to help guide you guys as well. So you guys can find that on our website as well. We go through all of this. We've also got Oxbridge interview YouTube videos where we've got them, where you can also go through that. These key things here. Now, the Oxbridge medicine selection criteria is actually very similar across different subjects and across different universities. So these are empathy, motivation, problem solving, alignment with NHS values, capacity for sustained and intense work, ability to work with others, communication skills, ethical awareness, honesty and integrity, intellectual curiosity. So, in summary, for personal statement and work experience, really think about the purpose and power. Think about the STAR technique. The quality over quantity in experience is really important, and also acknowledge the changes. Oh, you guys like the graph? So we've got loads of different graphs and stuff here. We will go through all of this with you guys later on, and this is something that we can go through at a much later stage. And this is something that I say we'll focus on Oxbridge interviews. We have loads of Oxbridge interview videos as well. Slightly early for that. It gives you a taster, but we cover all of this. All right.